have been told that you or your loved one need to have a central venous catheter called a CVC. The purpose of this program is to teach you how to safely care for the catheter. This video supplements information you will receive from the infusion therapy team. Before we begin, let's take a look at the different types of CVCs. The CVC is a small tube placed in a vein and then threaded into the largest vein in your body. The CVC is usually inserted into one of three locations. The PICC line is inserted into a vein in the arm. The subclavian is inserted under the collarbone. The femoral is inserted into the groin. Your doctor will decide which type is best for you. All CVCs have the same basic parts: the catheter, the winged hub, the catheter extension, the clamp, the cap hub, and the needleless connector cap. As long as there are no problems, the catheter stays in place for the duration of the treatment. The CVC can be used to give different types of IV treatments. These include chemotherapy, blood transfusions, fluids, and IV nutrition. The advantage of having a CVC is that it can be used repeatedly. You won't need a new IV inserted every time you have a treatment. Also, many chemotherapy medicines must be given through a CVC. There may still be some times when you need a small, temporary IV in your arm, but the CVC meets most IV needs. There are three parts to the care of your CVC. Those are the weekly needleless connector cap change, the flush injection to keep your CVC open, and the CVC sterile dressing change. For the weekly cap change, first gather a new sterile cap for each extension. Wash your hands briskly for 15 seconds and dry with a clean towel. Close the clamp on the CVC. Now turn the connector cap on the end of the CVC to loosen it, but do not remove. Next, peel open the package and remove the new cap. Loosen the protector end tip of the new cap. Then place the protector tip between the middle and index fingers of your non-dominant hand. The cap injection side should be facing up. Pick up the end of the CVC extension tubing. Remove the old cap. Lift the new connector cap from the protector. Be careful not to touch the open ends of the CVC or new cap. They must remain sterile. Insert into the end of the catheter extension. Twist the cap securely. When this is finished, open the clamp. If you have a catheter with 2 or 3 extensions, repeat the steps for those caps. Remember, never reuse a cap that has been removed. Once the cap has been removed, it is no longer sterile. Using it again could introduce germs into your catheter. Discard old caps and replace with new, sterile caps each week. Next, we'll talk about the flush injection. The purpose of the flush injection is to help prevent the CVC catheter from developing a blockage. The flush injection is usually done daily, or at least 3 times a week. Let's go over the parts of the syringe that you will be using. The parts include the plunger, the wings, and the barrel of the syringe with a protective cap on the end. The syringe contains the flush solution. Wash your hands for 15 seconds. Gather the flush and antiseptic pads. Open the syringe package. Check the label to make sure you have both the right drug and the right dosage. Check the expiration date. Hold the syringe point straight up. Remove the protective cover and pull down on the plunger. Make sure to protect the sterile tip of the syringe. Do not lay the syringe down or touch the end of it. Push up on the plunger to clear the air out of the syringe. Continue to do so until you see fluid drip out of the end of the syringe. Continue to hold the syringe. The end cannot touch anything. Make sure the catheter clamp is open. Now scrub the top of the connector cap with the antiseptic pad. Twist back and forth with friction for 15 seconds. Air dry for 30 seconds. Attach the syringe at a 45-degree angle to the cap. Then push and turn it to the right until it stops. Slowly inject the flush. Once the injection is complete, remove the syringe. To do so, turn the syringe to the left while holding on to the connector cap. If you have more than one extension, repeat the steps to flush each extension. Do not unscrew the cap while disconnecting the syringe. Make sure the cap is still secure on the end of the catheter. Throw the syringe into the trash. During the flush, if there is resistance, stop. Do not force flush the CVC because you could damage and rupture the catheter. Instead, check to make sure the clamp is open and that the syringe is attached correctly. If you still meet resistance, call the infusion therapy team. The catheter may have built up a blockage. The infusion therapy team has medicine that can safely remove a blockage the next time you return to the infusion therapy clinic. While this is not an emergency, it is important that you do not infuse any medicine or flush the catheter until this blockage is cleared. Now let's discuss the CVC dressing change. The dressing change needs to be done once or twice a week, depending on the type of dressing that you will use. Your nurse will tell you which dressing is right for you. You should also change the dressing as soon as possible if it is wet, loose, or soiled. If there is any newly occurring discomfort under the dressing, changing it might help. Make sure you have all your supplies. Wash your hands briskly for a minimum of 15 seconds. Dry them with a clean towel. Place a clean towel under your arm or shoulder. Wear non-sterile gloves. These gloves come in a box, much like tissue paper. Carefully remove the old dressing. If the tape sticks, you may wet the tape with either an alcohol or adhesive remover wipe to loosen it. Start at the bottom of the dressing, removing the label and tape. Never use scissors to remove the tape or dressing from your catheter. The risk for cutting the catheter is high. If cut, the catheter will have to be removed and other complications can occur. Keep working around the outer edges. Use one hand to push the skin down and the other hand to pull up the dressing toward the center. This will keep you from pulling too much on the patient's skin. As you move to the hub and sutures, push down on them with 1 or 2 fingers to hold them in place while removing the bandage. Now check the insertion site. Look for redness, swelling, pain, or discharge around the catheter insertion site. Next, check the stitches. The stitches hold the catheter in place. There are usually 3, the site stitch and 2 wing stitches. All 3 must be intact and in the skin. If you see any problems, finish changing the dressing and then call your doctor or infusion therapy nurse. Remove the clean gloves. Peel the package open. Place the plastic package to the side. You can use this to hold trash. Touching only the outside corner of the wrapper, open it away from you first. Use the antiseptic hand gel provided in the dressing kit. Pick up the sterile glove package and place it away from the rest of the kit. Then continue opening each corner of the wrapper using only the outside corner edges of the wrapper and pull all 4 corners away. Remember that you cannot touch anything inside the sterile field with your bare hands. If you forget and touch, you have contaminated the contents. Throw that kit away and open a new one. Open the sterile glove package. The gloves are packaged with the inside cuff turned out. Pick up the folded edge of the glove. Keep it sterile. Don't touch it except for the folded cuff. Lift it clear of the table and hold it away from your chest. Insert your dominant hand into the glove. Next, with the sterile gloved hand, slip your fingers under the cuff of the second glove and slip your other hand into the glove. Now you have both sterile gloves on. Be careful not to touch anything outside the sterile field of the dressing kit with your gloved hands. If this occurs, change your gloves right away with a new pair of sterile gloves. This includes not touching the patient's skin or the catheter itself with your sterile gloves. Look at what's inside the dressing kit: 2 Q-tips, a package of antiseptic swabs, extra tape, label, scissors, a protective skin barrier film swab, and a transparent dressing with antiseptic gel pad bandage. Lay them out so you can work easily with them. Pick up the antiseptic solution package. Use the scissors to cut off the top end of the package. Insert the 2 Q-tips into the pack. Clean with the 3 large chlorhexidine swab sticks first. Pull up one swab stick and start scrubbing at the insertion site. Move outward to include the hub and the stitched wings, and then continue scrubbing in a back and forth motion outward in widening circles. Be sure to clean all the skin and catheter that lies under the dressing. Discard the swab when an area of 3 to 4 inches from either side of the insertion site has been cleaned. Repeat using all 3 swabs. Next, use the 2 Q-tips to better clean the hard-to-reach areas of the insertion site, the stitches and under the catheter wings. Once all the swabs and Q-tips are used, you must wait at least 2 full minutes to allow the site to air dry. Do not skip the drying step. It is during the drying time that the antiseptic kills the germs on the skin. Full drying protects better against infection. Also, if a dressing is placed over the skin while it is wet, it can cause skin irritation, redness, and even blisters. Now open the protective skin barrier packet. This helps protect the skin from the adhesive. Cut the pack open with the scissors provided. Do not wipe the insertion site itself. Swab all edges of the cleaned area. Allow about 1 minute to dry. The next step is to apply the dressing. Before placing the dressing, if your catheter is in your arm, extend your arm fully out straight. If your catheter is under your collarbone, turn your head to the opposite side and place your hand on your hip, pulling your shoulder back. These positions will stretch your skin out and keep your dressing from being too tight and pinching your skin. For the transparent dressing, remove and discard your sterile gloves. Pick up the clear dressing. Peel the plastic backing off. Hold the edges of the dressing. Center the antiseptic gel pad over the insertion site. Center the V cutout over the extension. Do not stretch the dressing or it will pull on the skin. Press the dressing down onto the skin, starting at the center, and then move outward toward the edges. Continue peeling the paper off and pressing down the edges of the dressing. Secure the lower edge of the dressing with a strip of tape. Slip this tape up under the catheter extension and slightly overlap the dressing. Press down onto the dressing. Write the date and your initials on the label provided. Place along the lower edge of your dressing and cover it with a strip of clear plastic tape. When using the dressing with the antiseptic disc, you need to carefully open the appropriate dressing cover onto the sterile field. Follow the same steps in cleaning the CVC site as shown in the transparent dressing. Before removing your gloves, peel open the small, round antiseptic disc. Place this disc with the white side down and the blue tinted shiny side up around the catheter insertion site. This does not stick to the skin, so be careful not to move. Remove your gloves. Open the dressing and center it over the CVC. Pull off the tape edges to allow it to stick. There is a V-notch tape in the package. If your CVC has many extensions, you may need to make the V-cut bigger. Slip this tape up under the catheter extension. Slightly overlap the dressing. Press down. Write the date and your initials on the label. Place along the lower edge of the dressing. Cover it with a strip of clear plastic tape. You are done. Let's review some of the most important points. Before changing your dressing, make sure you have all the supplies you need. Keep the dressing dry. Protect it with plastic wrap when bathing. Never submerge it. Change the dressing once or twice a week as instructed. In addition, change the dressing if it becomes wet, soiled, or loose. Change the connector cap every week when not in use. Flush injections are usually given daily or at least 3 times each week. After placement, some patients may have bruising or soreness for a few days. This is normal. However, notify your doctor if you develop any of these problems. Signs of infection, such as redness, pain or drainage, a fever of 101 degrees or more, or new tenderness around the catheter site, loose or missing stitches, leaking from the catheter, or if the catheter is clogged, swelling or discoloration on your neck, chest, or arm where the catheter is located. We hope this education video helps you manage your CVC at home. You can view this video as often as you like, and you have the patient guide to refer to at home. You can also purchase the video from the Learning Center. Thanks for your attention.